I normally like calling it T21 so that other parents around, other people do not have a clue of what I'm discussing with my patient, rather than using the word Down syndrome. My name is Adegboyega. I'm a consultant pediatrician with special interest in neonatology, gastroenterology, neurology. By way of definition, T21 is also known as Down syndrome. It's one of the trisomies. It's congenitally inherited. Babies are born with T21. It's a condition that is not only found in Africa but all over the world globally. And that is why some countries actually have a club or a group of T21 children or babies with T21. There are various types of T21. Maybe the general population may not know, and that also gives us an idea of how they're going to do in later life. I'll just give us maybe it's more of academic thing that we have the non-digestion, which is quite common, and that has to do with maternal advanced age or advanced age in the mother. We also have the translocation downs and combined downs, in which case down can actually be combined with other trisomy, like down with Klinefelters. We also have the mosaic type, in which there is a defect and a normal gene. Those ones may do better, and to make this diagnosis, we may need to do a karyotyping. But they have features that are suggestive of Down, but the features are not for Downs alone. There are some other conditions like hypothyroidism that have similar features. I actually call them brothers and sisters, Down and hypothyroidism, congenital hypothyroidism, because they have quite a number of features in common. The cause is not actually known, but we know that we can't actually pinpoint and say this is the virus or bacteria, but we know it has to do with dislocation from one trisomy to another, in which case in Down or in trisomy generally, you have more than 2 chromosomes they are supposed to carry, and they're having like 3. And that's what actually happened. The clinical features of a patient with Downs, we can have them having what we call depressed nasal bridge, in which case you can see this nasal bridge being depressed, which make them to have what we call hypertelorism, in which we have the widening of the space between the 2 epicantha, this medial region, and also have low set hair. They have IH palates. Patients with Down also have what we call a third fontanelle. The fontanelle is something we see in front of the head when they are born. Yoruba people will call it awuje. And there's another one, anterior and posterior. So if a patient with Down, some of them do have one between the anterior and posterior that we call the third fontanelle. And they also have what we call the sandal gap. There's a space between the big toe and the other digits, the other fingers, not fingers, the other toes, not the big one. They are also prone to a number of disease conditions if they have Down. The common features of a patient that has Down is hypotonia. The tone is reduced. Usually the IQ is between 60 to 80%. They have flat facial profile. So a lot of them look like the Chinese. and they have an epicenter food, and that is why some people call them Mongol, because they have the Mongolia facie, and that's why they call them. And if you have seen the Chinese before, and you have a child that looks like Chinese, and the father is not Chinese, neither is the mother Chinese, it might be that the child has T21. I normally like calling it T21 so that other parents around, other people do not have a clue of what I'm discussing with my patient, rather than using the word Down syndrome. I call it T21. I will make a diagnosis by doing a karyotyping, apart from the clinical features that are typical of Downs. But be that as it may, we need to rule out hypothyroidism, which is treatable if we are able to treat a patient with hypothyroidism before the third month of life. The child is likely to be okay by giving tyrosine. So we should not mix them up. It might be that we are dealing with hypothyroidism and not T21. So for that reason, we need to do a thyroid function test, in which we do the T3, the T4, and the TSH. And if that is the case, and it's hypothyroidism, good, we may be able to treat that. A lot, we need to counsel the parents that this child may not be able to do well like every other child in school. They need special school. The government really needs to be involved. The NGOs need to be involved, because the parent might not be able to take care of this child alone. The burden is great. Even for the people that are also managing them as doctors, for me, seeing a patient with Downs does not make one feel so happy. And there are quite a number of young mothers that are also having Down T21 these days, and they need assistance. So it's a multidisciplinary thing. One other thing with Downs that I didn't remember to mention as part of the clinical feature is that they also have an endocrinial cardiac defect. You may be a VSD, or sometimes they have an ASD with a VSD. An ASD is an atrial septal defect, like some people will call it a hole in the heart. And they may need an echo for us to be able to detect that, so that it can be treated on time if they have this hole in the heart. They are also prone to having leukemias and some other disease like that. But when it comes to management, the parent cannot be left alone in this. There is need for government involvement, and if possible, hospitalization. Down's patient or T21 are not the type that would achieve the developmental milestone as early as when they should. They have delayed the milestone. So they may not be able to control the neck when they are supposed to. They may not be able to walk when they're supposed to, but invariably they get to do these things. They also will need occupational kind of therapy to help them, so that they are not just depending on the parent for everything. And there's need for psychotherapy, because I can imagine the parent of a child with Down syndrome, T21, what they are going through, the stress. They also need to be encouraged. I know some of us, we have questions. Some might actually be thinking of, how do I prevent Downs? So that I don't have a child with Downs?